So we offer lots of different ortho services at Madison Family Dental, and so I want to talk a little bit about what we've got for our patients. Given that we are an all ages clinic, we start seeing kids at a year, and we have lots of older patients too. And so something that comes up fairly often is the question of orthodontics, and really who is that right for. And I would say there's no real right age for ortho. We have a lot of adults that are coming back, kids are out of the house, and now they feel like it's their time to explore their orthodontic treatment. And we see a lot of kids coming in like 6, 7 years old that maybe they have more growth issues going on. And so sometimes we'll see kids coming in with a jaw that's shifted one way or the other, or maybe the whole top jaw is inside of the lower jaw. So it's really an interesting area that we are working in, and we really like it a lot. Seeing the kids and taking them with appliances and things like that to help develop airway or more normal growth pattern in their jaw. Simply just making room for teeth that would be blocked out, where in the past we would have maybe thought about taking some of the adult teeth out in order to make room for those teeth in the long run. That's something we don't do very much of anymore. By doing more of the functional ortho that we've got now, the idea is to lay the framework really to have all the teeth fit in, have nice development, good airway, and a really nice solid foundation forever and ever. With adults, it's a little bit trickier on some of that jaw development type stuff, because as adults, we've been through most of our growing, and that's kind of completed by the time we see you. However, there's still a lot of things we can do. We use some appliances for adults. We have options for traditional straight wire orthodontics with brackets and wires. We have removable options like Invisalign or bioliners. And so really probably the most important thing is, talking with your dentist. And maybe it's your dentist that identifies the problem, or maybe it's something you've been thinking about for a long time too. And so really just when you're in, having that conversation, and then taking that next step, finding out, what your goals are. And then also what we see, a lot of times I'll see people that come in for ortho consultations, and they'll say, well, I have this one tooth that's bothering me here. Well, then in the course of us talking and looking, we'll see like, okay, well, you're a little narrow in the back. You've also got this going on here. Have you thought about that? And so we really try and take a total picture of the person before we come up with a plan. And then sometimes our plan is the same as your plan, and sometimes I see patients that come in simply for some anterior cosmetic work, and we certainly can do little touch-ups like that, but it is really nice from a long-term stability standpoint to be able to treat all of the dentition and make sure that your bite looks nice, that you have room for your tongue, that airway space is good in the back. And so adults, there's a little bit more limitation there. However, we still get really great results with adults. With kids, the nice part about doing ortho on kids is we get to play around with that growth, and we get to help guide that growth. So a lot of it, oftentimes we refer to it as functional orthodontics, and a lot of it has to do with proper oxygenation, good airway space in the back. We always look for things like large tonsils. Do they snore? Are they a restless sleeper? Are they grinding? Do we have any behavior type issues going on? That sort of stuff. And so the thing I like most about kids is that it's not just straighten your teeth. It's also kind of all these developmental things along the way, and hopefully by kind of correcting some of those things early on, maybe down the road we end up and we don't have that adult that has sleep apnea, or we don't have that adult that has that extensive wear from all those grinding patterns. So there's a lot of great options. We've got a lot going on here, and if you have any interest, you should come on in and talk with your dentist.